Hello and welcome. I'm Melissa, chiropractor and chief developer of the MKR chiropractic recruiting process. In our last two videos, we have tackled the topics of how do I know how I want to practice, how do I want to be engaged in employment, and now we need to talk about how you can evaluate whether a doctor and his office are going to be an appropriate, healthy relationship fit for you. There are probably 20 different categories that you could evaluate on. I've chosen 5. All right? So the first one I feel associates should take a look at would be, has this doctor ever had an associate before? And if he or she has, how long was that associate there? Were they there for 7 years and then moved to a different part of the country? Or has he had 3 associates and they only stay in the practice for 18 months? I would say that the latter is probably a red flag that you're going to want to investigate a little bit further. Second, how long has this doctor had their front desk staff with them? Is front desk staff turning over every year to 2 years? Or has their staff been with him or her for 8 to 10 years? I would say the first one with high turnover, that's an area you'd probably want to steer clear from. Number 3 is the office clean and tidy? And is it up to date? Or do the walls need a good painting? Is there dust on everything? And is the place completely cluttered? Because I've got to tell you, if the place is cluttered and the doctor has stacks of paper on his desk or her desk, this is a doctor that has an issue with what we like to call in the chiropractic profession incomplete cycles. And if you're working for somebody that can't complete their cycles, this is also a recipe for disaster. The fourth one would be, does this doctor offer a clear, concise, printed out 90 to 120 day training process? Do you know exactly where your expectation and benchmarks are going to be on a 30, 60, and 90 day basis? How are you going to be evaluated, and what expectations does the doctor have of you? This is one area I see doctors falling down in all the time. Even if they've never had an associate before, they may not know that a training program is incredibly important. Number 5 is, does this office that you may be looking at and working in, do they have clear policies and procedures, not only for office staff, but do they have procedures and policies for their practice members? Is there a way to do a day 1? Is there a way to do a day 2? This is how we do a pass-off with the front desk, and here's how we communicate in our office. That's incredibly important. Along with this piece is, does this office use technology? Or are they back in the dark ages and writing everything on paper? Technology is there generally to make things simpler, easier, and it's a way to get more done and offer people a high level of service. For example, do they use maybe email or text messaging to remind their patients of upcoming appointments? As bizarre as I thought this thing was a couple years ago, I can't tell you how much our practice members appreciated having that opportunity to be notified within 2 hours of their appointment that they needed to be somewhere. This covers the 5 top areas I feel are some of the most important when seeking out a doctor and evaluating her office to make sure it's going to be a good fit for you. This ends my top 3 question and answer session for how you may want to evaluate moving into employment relationships. I offer to my members a number of training videos. These videos run 15 to 20 minutes, and we tackle topics like how to evaluate an employment contract, how do you structure a payment system for when you're an associate, as well as job interview skills. I've got to tell you, just how you walk into a room, the handshake and the eye contact you give somebody, that can make or break an interview right there. For $99, you are going to receive valuable information that could make or break your first employment relationship. You're not getting this information anyplace else. So please accept my invitation. I look forward to having you as an MKR Chiropractic Recruiting Practice member.